The next entity is rhabdomyosarcoma. This is the malignant neoplasm showing skeletal muscle differentiation, and head and neck is the most common area, especially in the nasopharynx area. The second common area is the genitourinary tract. There are several subtypes of rhabdomyosarcoma, including embryonal, alveolar type, pleomorphic, and spindle cell sclerosing rhabdomyosarcoma. Here I just want to talk about alveolar rhabdomyosarcoma because they have some unique feature. I hope after this lecture you can have good enough sense to make diagnosis of this alveolar type rhabdomyosarcoma. So alveolar type, that means they can mimic kind of alveolar in the lung, but the neoplasm is this small round blue cell inside this alveolar-like area. You can see this cohesive of these cells. If you are lucky, you may see this kind of rhabdomyosarcoma cell just mimic this rhabdoid looking or maybe plasmacytoid, whatever term you want to use, just this eosinophilic cytoplasm and then eccentric nucleus. So when you see this cell, you really want to use a Desmin to just screen for it. Then the tumor cell itself, just this small round blue cell looking, and some mitosis is not difficult to find. And then, as I mentioned, Desmin is a good sensitive marker for this skeletal muscle differentiation. And more specific marker, you can use MyoD1, myogenin. Then, specific translocation for this entity is T12, 13, or translocation 1 and 13. That is the PAX3, FOXO1, or PAX7, FOXO1 translocation. So as I mentioned, the cell look like the same. They are all round blue cell because they have specific translocation. So this is the alveolar rhabdomyosarcoma. In low power, this kind of neoplasm just really blue, and then between this blue necks of cell, you have this pink sclerotic fibrosis collagen or spindle cell looking, just separates this blue area of malignancy cells. So when you low power, you find this feature, you need to suspicious for alveolar rhabdomyosarcoma. Then, of course, you always would like to see alveolar type, but sometimes it's not that classic. One of the hints here is we can see this cohesive population. If you want to see alveolar type, you just zoom in this cohesive area, so you can see they're forming this kind of like alveolar area separated by this fibrous septate, and then the cell is this cohesive small round blue cell in this alveolar mimicker with this small round blue cell, so you can make the diagnosis of alveolar rhabdomyosarcoma, and then flow your immunomarker Desmin, and even using other myogenin, MyoD1 to find this skeletal muscle differentiation, and then use FISH. PAX3, FOXO1, and PAX7, FOXO1. So this is alveolar rhabdomyosarcoma. The next one is teratocarcinoma